Welcome back to What's Now. Right now, we are going to focus on your cholesterol. How can you maintain healthy cholesterol levels? What can you do to reduce your risk and much more? Well, let's find out right now.
February is American Heart Month, and cardiovascular health remains a growing public health threat. Although nearly 34 million American adults are being treated for high cholesterol, 1 in 4 still don't have it under control, putting them at increased risk of cardiovascular disease, the #1 cause of death in the United States. Here with more important facts about managing cholesterol that everyone needs to know are Katherine Wilemon, founder of the FH Foundation, and Dr. Pamela Taub, a cardiologist at the University of California, San Diego. We appreciate you being here with Park 2 Television today.
Our pleasure.
Thank you. Can you tell us what contributes to high cholesterol and the risks surrounding it?
First of all, why do we care about high cholesterol? And the reason we care is because it's a very important contributor to cardiovascular disease, which is the leading cause of death worldwide. There are typical risk factors for high cholesterol, and those include lifestyle factors such as what we're eating, how much we're exercising. And then there's also genetic factors. There are many people that are just predisposed to having high cholesterol because of their genetics. And when we talk about high cholesterol, we really do need to focus on a specific parameter, and that's the LDL cholesterol, or the bad cholesterol. This is what deposits in our arteries and causes plaque and eventually leads to heart attack and strokes. And a good way to remember this is L for lousy and L for low. This is the number that we want to really focus on lowering.
And Katherine, can you tell us about other factors that can lead to high cholesterol?
Absolutely. So most people think of cholesterol as coming from your diet, and in fact, a certain percentage does, but our bodies also make cholesterol. And for those of us who are born with a genetic condition called familial hypercholesterolemia, we can't break down the cholesterol that's in our bloodstreams, either from diet or naturally. And so we have high cholesterol from birth, which leaves us at very high risk. We're actually at about 20 times the risk untreated as someone else for having a heart attack in the prime of our lives. And 90% of people who have familial hypercholesterolemia don't know they have it, even though it's very common. 1 in 250 people have FH. And that's why I started the FH Foundation. After I had a heart attack at the age of 39, I discovered that my oldest daughter had inherited FH from me. And most importantly, that this was a common story, that people didn't know they had it until they already had heart disease. So we partner with Aspirion, which is a company focused on cholesterol, to raise awareness of LDL cholesterol as a very important risk factor, whether it's inherited or comes from diet.
And Katherine, how can people know if their elevated cholesterol is caused by FH? What should these people do?
So it's pretty simple. Although it is so underdiagnosed, you can look at your family history and say, were there heart attacks or needs for bypass surgery or stents that your aunts or uncles or parents or grandparents had? Today, it's different. There are a lot of therapies, and if people get an early diagnosis of FH, they can have their family members screened, because every child of someone with FH has a 50% chance of also having FH, and they can take medical therapies early in their lives to prevent heart attacks and stroke.
And Dr. Taub, besides seeing the doctor and getting tested, what can people do to manage their cholesterol?
One message that I want to convey is high cholesterol is a very treatable condition. So there are a lot of lifestyle strategies that people can deploy to lower their cholesterol, but there's a lot of new pharmacologic therapies that are available to lower cholesterol. We've traditionally relied on statins for the past 30 years, but now we have a lot of non-statin alternatives that can also help lower cholesterol. And to learn more about what your cholesterol number means and different strategies that you can adopt to lower cholesterol, I recommend you check out the fhfoundation.org website, as it's a really well-curated website with a lot of good resources for our patients.
And doctor, what are the key takeaways that you would like the public to know about solutions to lowering cholesterol?
First, know your numbers and specifically know what your LDL or bad cholesterol number is, and work on lifestyle modification. And if you need further lowering of the bad cholesterol, have a detailed discussion with your healthcare provider about what the right options and strategies for you are in lowering the LDL cholesterol.
Well, thank you so much, Katherine and Dr. Taub, for joining us today, giving us this important information about lowering our cholesterol.
Thank you.
Thank you.
Thanks for watching this episode of What's Now. I'm your host, Christine Napier. We're grateful that you're here with us today. Be sure to tune into Park City Television all day, every day. You can head to our website, parkcity.tv, for more exclusive programming information. We'll see you next time.